Hello and welcome to yet another episode of Doctors In. Today we have with us Dr. Amel Antony, who have been specialized in radiology. Let's welcome him to the program. Welcome, Doctor.
Thank you.
First of all, could you tell us your experience in the field of radiology?
I've been practicing radiology for the last 20 years, and this mainly involves ultrasound, CT, MRI, mammography, and a bit of conventional radiology.
Okay. Could you explain to a layman what actually is interventional radiology and image-guided medicine?
Yes. Now, routinely in radiology, what we do is interpreting various studies. For example, if a chest X-ray is taken, we look at the chest X-ray and decide if the X-ray is normal or if the patient has got some abnormality. Similar with a CT and an MRI and an ultrasound. Either we do it and then we come to a conclusion, or we look at the films and try to interpret what is abnormal or normal based on patient's history. Okay. Now this is what is known as diagnostic radiology. Means we look at the images and decide, correlating to the patient's history, what is normal or abnormal. Now the other branch of radiology is what is known as therapeutic radiology or interventional radiology. Now intervention means the radiologist is intervening on behalf of the patient. Okay. And why this intervention is done? This could be for various reasons. One, to further the diagnosis. For example, we may go for a biopsy, or further the treatment. For example, we will actually treat certain conditions. For example, a vessel is blocked. We can put in a catheter and open up the vessel. And a vessel is enlarged, what we call as an aneurysm. We can actually block that vessel by putting in multiple coils. So this is therapeutic. Or for example, there is a small tumor in liver which we can ablate. That means completely cause destruction of the tumor or a liquefaction of the tumor by putting in radiofrequency waves, what is known as radiofrequency ablation. Okay. Or in certain cases where patient has reached a stage where the disease is much advanced, where a complete cure is not possible, but the patient is in pain or some other incapacitating condition, where we can intervene and try to mitigate the suffering of the patient. This could mean reducing the pain by injecting. For example, patient has got a cancer of the pancreas. This could be very painful. What we can do is we can cut off that nerve which supplies that particular area so that the patient's pain comes down. Okay. Or if there are multiple tumors, we can deal with some of these tumors. Or patient has got a vertebral collapse and patient cannot undergo a definite surgery. So we can actually strengthen that particular vertebra by injecting cement into that vertebra. So all these are palliative procedures where they are not definite, but definitely will mitigate the suffering of the patient. Okay. So whenever the radiologist intervenes on behalf of the patient, it's an interventional radiology.
Okay. What is the difference between interventional and diagnostic radiology?
In diagnostic, radiologist just gives the diagnosis and waits for other physicians to go ahead with the treatment. While in interventional radiology, the radiologist actually sees and diagnoses the case. As I said, a patient comes with a stroke, one side is paralyzed, and then you take up the patient into the cath lab, you put in a catheter, inject contrast and see which vessel is blocked, that particular area, and if that vessel is blocked, you inject certain medicines or try to open up using a balloon that particular vessel. Now this is done so that the damage to the brain is controlled and the patient has got an early recovery with very less deficits. So that is treatment. Now intervention means it need not always be treatment, but it can also, as I said, part of the diagnosis. For example, if there is a lesion in the lung or a small lump in the lung and we are not sure what it is, unless we are sure, we cannot treat that lung. So in that case, lung containing air, it's difficult to go in otherwise with a needle in a blind manner. So we use image guidance. Okay. If it's a peripheral, means outside, very much outside of the lung, we can actually use ultrasound. Or if it is inside the lung, close to major vessels, we can use CT for guidance. We use CT, identify the lesion, and then place a needle accurately into the lesion and get it sample out so that we get a clear diagnosis. Okay. So basically, treatment, diagnosis. So these two things are combined in interventional radiology. When we talk about interventional radiology, it is either vascular intervention or non-vascular intervention. Vascular means putting in catheter to either open up vessels or block vessels which are enlarged. Non-vascular means it could be diagnostic aspirations or it could be palliative procedures.
Okay. So how will the test for radiology take?
Radiology tests, a lot of patients have apprehension. Actually, there is nothing painful in radiology. Of course, the only painful procedure is when you are giving contrast. You have to put in an IV line and then contrast has to be injected. This for CT, the iodine containing contrast may give you a feeling of warmth. But other than that, the needle placement or the catheter placement, that is the only painful procedure. Radiation as such will not cause any pain. Similarly, in MRI, again, there is nothing painful there, but the only thing is in a large bore magnet, what we call as a tunnel magnet, some patients may find it difficult to lie down in a tunnel magnet because they may feel fear, they may have fear of closed spaces, what we call as claustrophobia. Other than that, MRI also there is nothing to be apprehensive about. Of course, when we take up the patient for MRI, there are certain precautions which we require. One is there are certain instruments which are placed in the body which can malfunction or completely stop functioning when the patient is in a magnetic field. One is of course the pacemaker. So if the patient is pacemaker, it's a contraindication to take up the patient for MRI. Of course, the current scenario we have MR compatible pacemakers. So most of the new things are coming out to be MR compatible, but otherwise any of the devices placed inside the body, this should be brought to the attention of the radiologist so that we can check out whether these things are compatible with MRI. Otherwise, MR investigation is also nothing to be apprehensive about. Now coming to ultrasound, ultrasound is, it doesn't involve radiation, it doesn't involve magnetic field, it just involves sound going through your body, you never feel it, and it's the most comfortable investigation possible. Similarly, when we look at the vessels, for example a Doppler study, other than the probe being placed on your body, the particular part, there is nothing painful about ultrasound Doppler studies. So by and large, there is nothing painful in radiology. Of course, when we are going for interventional radiology, the situation is a bit different. You are going to place in a catheter into a vessel, so for which you have to make a sufficiently large enough wound inside the vessel so that the catheter can go in. But of course, this is done after giving local anesthesia. So it's only the initial puncture you will feel. Once the catheter goes through the vessel, there is no feeling or there is no pain involved. Similarly, when we are going for a biopsy, it's always advised or it's always practiced that we give local anesthetic in that particular area so that the patient doesn't feel pain.
Okay. So will interventional procedures hurt?
They may hurt if in the initial part, for example, as I said, a biopsy. Now a biopsy of the liver, these are all pain, the capsule is painful, the lung pleura, the outer covering of the lung is painful. So all these, when it's punctured, it could be painful, but by and large, we always anesthetize the liver capsule or the lung pleura so that it is comfortable for the patient. It is the initial puncture as the needle enters or goes past the skin which is painful, for which a local anesthetic is always administered.
Okay. So how safe are X-rays?
X-rays, remember X-rays are radiation. Now radiation, when we talk about it has got harmful effects. Then why do we do chest X-rays? So whenever we go for a procedure, there is a concept of risk versus benefit. Now what is the risk involved in taking a chest X-ray? Now chest X-ray, we have a quantification for the radiation involved, something like 0.02 millisievert. Now this is very minimal. You receive much radiation if you go on a transcontinental jet flight. For example, the background radiation which we receive. Now even then, we are concerned about radiation exposure. So always a radiology procedure is asked for looking at the benefit which will accrue to the patient. Now what is the benefit? Benefit is an accurate diagnosis or ruling out a particular condition which has been suspected. So based on this, a physician recommends radiological studies. Now remember, if a chest X-ray is just 0.02, but when we come to CT, say for example an abdominal CT, it is equivalent to 100 chest X-rays. But then why do we do it? Because we have to get details of a particular tumor. We have to stage that tumor so that we can give accurate treatment. And remember, a patient undergoes CT of a particular area maybe once or twice in a life. So this falls well within the internationally accepted radiation permissible doses. So that is one concern. Now the other thing is radiation, say if chest X-ray is less harmful, CT is more harmful. When we talk about radiation effects, there are two types of effects which we look at. One is the genetic effect, which we all know. If the fetus or the growing fetus within a mother's womb is subjected to radiation, we know that the child can have genetic abnormalities, which is proven right from days of Hiroshima and Nagasaki. Still there are chromosomal defects in certain generations of people there. So that shows the effect of radiation on fetus or on dividing cells. So that is there. That is known as genetic effect. Now this genetic effect is based on the strength of the radiation. Higher the radiation, higher the genetic effect. Now there is another effect, what is known as stochastic, or it is not dose related. That means a chest X-ray or a CT abdomen, which is around 100 times that of a chest X-ray, can have similar effect. Now this is what is stochastic effect. Now this stochastic effect is not dose dependent. So a single exposure or multiple exposures will increase the chance, but even a single exposure can cause stochastic effects. So these are things which we are concerned about. Now the routine radiation effects, now genetic effect can fall into this non-dose dependent, while the skin, color discoloration, the vomiting, the GI upset which you get after radiation, especially people who go for radiotherapy, or fever, or bleeding from various sides, all these are because of radiation effect on dividing cells, either in your gastrointestinal tract, or it affects your bone marrow cells, so your count goes down. All these are because of effect on dividing cells, and this effect is more with increasing dose.
Okay. Lastly, what is the advice that you would like to give to the audience?
The advice is radiology or radiological procedures are an essential part of diagnosis. Now remember, a patient comes to a hospital with a particular condition. In addition to your routine lab tests, what the patient does is undergoes a particular radiological procedure, starting with a chest radiograph, an abdominal ultrasound, and if required, a brain MRI, and then based on all this, further procedures. And now why this is done? This is to localize a particularly suspected condition, or as I said, to rule out a condition. And from radiology, what is done further? Either patient goes in for interventional radiology, or if it's a tumor, the next step is go in for a biopsy and decide what it is. So then comes pathology. So radiology and pathology are the last stop before we diagnose a particular condition. So they are essential. There is nothing to be apprehensive about. Now radiology is part of the treatment process. It can be just diagnostic alone or being treated in a way that patient does not have to undergo major procedures. So interventional radiology, that is what it's about. Instead of doing a surgery, an open surgery, you can go in through a vessel and treat the patient completely.
Okay. Doctor, that was nice talking to you. Thanks a lot for being a part of our program.
Thank you.
So that was Dr. Amel Antony with us. Until we meet next time, this is me, Naina, signing off. Take care.